Hi guys, welcome back to my channel. So it's officially interview season, and today, as you can see from the title of this video, I'm going to be talking about how to answer the golden question, why dentistry? This is a question that tends to be asked a lot at interviews, and not just in interviews, but when you tell people that you want to be a dentist and you're studying to be a dentist, they will usually ask you why. Why did you go into dentistry? But today we are going to be focusing on how to answer it in an interview setting and also how I approached this question. I'm not going to be going into all the reasons why I decided to go into dentistry, but rather the way I answered this question during my interviews. When answering this question, you need to be confident and convincing and not leave any doubts in the minds of the interviewers about your reasons for wanting to study dentistry. You know, when you watch TV shows and people just bring out all the sob stories and all the things that happened to them in their childhood and why they should win a place on the TV show, you don't really need all of that, although it does help if you have an anecdote. But most people will be introduced to dentistry through having braces as a child, or just through having normal dental checkups, or maybe through their work experience, and these are all really good reasons for wanting to study dentistry. You just need to be able to reflect on your personal experience and how dentistry is going to help you make an impact in society. For this question, I had 4 main points, and this is the sort of technique I use to approach a lot of my interview questions, both the ones I was expecting and the ones I wasn't expecting. I would try to organize my answers into 3 to 4 points. So for a lot of other questions, it was about 3 points, but for this question, I kept it to 4 points because it's quite a big question, and that helped me to keep my answer quite focused. Meaning when I'm talking to the interviewer, these are the 4 main points I want them to leave with. These are the 4 main points I want them to write in their little tick sheet or remember me by. This is a really good tip to keep in mind if there are questions you don't know how to approach or you're quite worried about waffling. Keep your answers to main points that directly answer the question, and then back it up with work experience or extracurricular activities or examples from your wider reading or just anything else that links to dentistry. My first point was all about a personal experience that I had with dentistry, and it's always a good idea to bring in some form of personal experience into your answer because it will help you to give a much stronger answer. In life, there's the concept of a USP, so unique selling point, which is essentially a factor that differentiates you from other dental applicants, and this is one of the ways you can show that. Interestingly enough, it wasn't my dental experience, but it was the dental experience of a family member who had a series of painful dental flare-ups that happened around the period before I applied for dentistry. They couldn't eat properly, talk properly, or even get a good night's sleep. I took interest in their case and I asked them if I could follow them to dental appointments, and they agreed. And I saw them go from being in severe pain that affected their daily life to being completely healthy and not in pain. I found it interesting how just one tooth in the mouth can cause so much problems and affect a person's entire well-being. And I turned this back on myself and talked about how I also want to be able to gain the skills and the specialized knowledge that is needed to be able to improve other people's quality of lives through their oral health. So that was part of my initial insight into realizing that dentistry was a career for me. And when you tell an anecdote, you don't just want to tell the story because it sounds interesting. You want to reflect on it, and you also want to link it to several attributes of dentistry that is meaningful to you. For me, it was the manual dexterity side of dentistry, and this is probably going to be the same for every other dental student that interviews on the day. They will probably mention something about manual dexterity in their answer for why dentistry. So to avoid sounding cliche, you can give an example of a hands-on activity that you enjoy doing, whether it is playing the guitar or doing art or whatever it is you enjoy doing. Just emphasize the fact that you enjoy working with your hands, and you also enjoy activities that require precision and activities that require you to have a steady hand. My third point was where I talked about how I enjoyed science and how I would find it really interesting to learn about science that is related to dentistry. Since coming to dental school, we've learned about a concept called evidence-based dentistry, which means that most treatments and most practices that dentists do are based on solid scientific research. And finally, there's the long-term relationship that dentists form with their patients, which I thought was quite unique to dentistry and something that I also wanted to be able to do as a dentist. So when you know what to say and you're prepared, answering the question why dentistry can be quite straightforward. But the one that people tend to get quite nervous about is why not medicine, or why not pharmacy, or why not nursing, or why not any other healthcare course that is out there? That question is quite intimidating because you don't want to put other healthcare courses down or downplay the importance of other courses that are equally as valuable in society. I didn't get asked this question, but I was prepared for it because I had actually considered a lot of other healthcare courses. And for me, dentistry was one of the only careers that I came across where you could see patients when they are sick and also when they are healthy. For a lot of other healthcare careers, you tend to see patients when they are in poor shape or when they are in a bad condition. But with dentistry, to a certain extent, you can advise patients on how to avoid certain diseases such as tooth decay or gum disease, and that's why there is such a huge focus on prevention-based dentistry. So you could say that the patient journey starts from before the patient even gets a dental disease in dentistry. Compared to medicine, dentistry might not be life-saving, but it is life-changing, and I was able to see that through the family member that I spoke about and also through my work experience. So back to my 4 main points. I know it sounds quite extensive, but this is the one question you don't want to keep too short or too brief. If you're asked why do you want to study dentistry for 5 years, 5 to 6 years, and you give a 30-second answer, it's going to sound as though you haven't really thought about your answer. It's better to prepare with as much as you'd like to say, and then during the interview environment, you can gauge how much the interviewer should know or how little they should know. You can gauge how much to expand your points and how long you want your answer to be. You also don't want your answer to sound too listy or like a shopping list, because you'll say the exact same things that other people are saying without you personally reflecting on it and explaining it in your own way. Other reasons may be lifelong learning, or wanting to specialize in a particular dental specialty, or wanting to help people with their dental health, as I mentioned before. But just make sure you're not listing them out. Make sure that you are able to explain why they are meaningful to you. A couple of tips for answering this question, and I've got 4 tips here. Guys, 4 is not my favorite number, I promise. I don't know why everything in this video is 4 related. My favorite number is actually 7, but I couldn't think of any more tips, and I've got 4 written down here. So tip 1, it goes without saying, try to stick to what you've already written on your personal statement. Don't go and invent a whole different story that doesn't even link to what you've written on your personal statement. The two still have to correlate. So stick to what you've written on your personal statement, maybe even reference some things that you said on your personal statement and just build up from that. Tip 2 is to pick strong reasons for why you want to study dentistry. Now, there are some good and there are some risky reasons to tell an interviewer when answering this question. You might genuinely mean one thing, but it might come across as something completely different, or even a red flag in the interviewer's mind. So for example, focusing on the financial rewards of dentistry, it's not really a wise way to answer this question, or even comparing it to medicine and saying you think dentistry might be easier than medicine. If you believe that, let me tell you now, it's still hard work, because the interviewer is going to be thinking, when it's really hard, is this student going to be able to cope? Or is this student being motivated by the right reason to study dentistry? And another one I would be careful of, and I wouldn't say don't say, but I would be careful of how you present it, because it can also get misinterpreted, is if your family member is in dentistry, because you don't want it to sound like they are pushing you or they have significantly influenced your decision. You want to phrase your answer to let the interviewer know that you have also gone out of your way to consider dentistry as a career path for yourself. If you don't have a personal anecdote, you can still give a strong response and bring in examples from your work experience. Think about the most interesting case you saw, how it made an impact on you, and how it allowed you to understand what a realistic career in dentistry entails. Practice this question as much as you can, but don't sound too rehearsed. you already know that this is one of the questions that could come up, which puts you at an advantage. And the interviewer already knows that this is one of the most popular interview questions to ask. And so when they ask it, they're expecting you to be prepared. You don't want to sound like you're trying to recall something that you've memorized. You don't want to sound like a robot. You want to show a bit of enthusiasm with the way you use your hands, with your eye contact, with your body language, with your tone of voice, and just the way you're confident in your response to this question. Try not to jump straight into answering this question in a way that when you are asked a follow-up question, the follow-up question visibly throws you off and you were previously confident and gave a smooth, well-prepared answer, and then for a question that you have to think a bit more about, you are umming and ahhing and you can't quite get your words out right. Make sure that you kind of keep the same calm energy with all your interview questions, and before you even answer this question, even though you thought about the answer, maybe just like take a moment to think about it, even though you already know what you're going to say, but take a moment to think about it, and then keep the same approach of showing that you're thinking about all of your interview questions, including the ones that you've prepared for and also the ones that you're not well prepared for. And stay calm throughout your interview. For me, I had my 4 main points that I didn't exactly memorize, but I had practiced so many times and I knew how to talk around those 4 points. When you memorize something and then you're put under the pressure of your interviews and maybe you lose a place, it can be quite hard to then find where you stopped and continue from there. So have points of what you want to talk about and be able to talk around those points. So that's it, guys. Thank you so much for watching and I hope you found it useful. I remember just wondering what other dental students had said for their why dentistry question and how they phrased it or approached this question, or now you know what one dental student said for this question. If there are any other videos you would like to see on my channel, please leave them in the comment section down below. I'm not making any promises, and I'll catch you guys in my next video.